Good afternoon, everybody. This is Carly Kakasulev, and I am so excited that you are joined us today to present the OfficeEMR new MIPS dashboard. A little bit more about me. I have been with iSalus Healthcare for 11 years now, and I have a very multifaceted role. I have overseen all of our ONC, DEA, SureScripts, and other certifications that we have done with OfficeEMR. And my main mission is to work side by side with all of our clients to understand your needs so that I can take that information, that knowledge back to our development team, and we can design cutting edge solutions for you. So it is my privilege to present to you today our new MIPS dashboard and help walk you through being successful with the MIPS program. A little bit more, you guys are all muted, so if you have questions as the webinar goes on, along the bottom of the Zoom meeting, you'll notice there is a Q&A section. Click on that and you will be able to type a question to me. And then once we get to the end of sections, I will check for questions and answer them all at once. Just want to briefly go over our agenda for today. So the first thing we're going to cover is just provider eligibility. How can you go out and see which of your clinicians are eligible for the MIPS program to make sure that you participate correctly? We will then walk you through how to set up the MIPS dashboard, going through each of the components of MIPS, which would be the quality measures, improvement activities, and advancing care information. And of course, I will stay on at the end of the webinar to answer all of the questions that we have. And if we do run out of time, we will send all the answers to your questions via email. So first, who is included in MIPS? I want you to get familiar. Hopefully you've got pen and paper and you're ready to take some great notes. But one site that I want you to write down in your notes is this QPP.ms.gov. This is the website that CMS has put together specifically on the quality payment program. You'll notice here on the front page, you can check your participation status by plugging in all of your clinicians' NPI numbers. And it's going to tell you exactly what you need to do, whether they need to participate as an individual. If you're participating as a group, it will tell you if they need to participate at the group level or whether they're excluded altogether. Right? So this site also is your central resource for all of the information on the MIPS program. If you've not been to this website, and you go to it, and again, write this down in your notes and make this one of your favorites in your Internet Explorer bar. So just want to let you know you've got options this year as far as if your clinicians are eligible to participate. Obviously, everything in life is a choice. So you can, first of all, do nothing. Just to let you know, if you do nothing, that's okay, but you will be seeing in 2019 a 4% payment penalty on your reimbursements from Medicare. Our goal for you is that you will avoid that and you will at least do testing. So if you want to do the middle option, that's just submitting the minimum amount, and we'll walk through what that means. But to do that, you can submit one quality measure, you can do one improvement activity, or you can do the advancing care information and meet the base requirements. And again, when we get into the MIPS dashboard, I'll show you how you can do one of those minimum options, okay? And then the final option, I think a lot of our clients are going after this. We're calling it the Go for the Gold option, and that you're going to submit at least 90 days worth of data to Medicare. You're going to focus on your quality measures. You're going to focus on selecting at least one improvement activity, and then again, the advancing care information section, which, if you want to think of it, is the old or is the new meaningful use. So hopefully that gives you kind of an overview of what you need to do. As iSalus is your EHR company, we're we're hoping to all of our clients will avoid this negative payment adjustment, and that you'll at least avoid any positive or negative payment adjustment by at least testing, okay? So let's go ahead and we're going to go into Office EMR. So just one moment. And let me bring over Office EMR. And let's jump into our dashboard. So another place that you can check your clinician eligibility is using our provider setup screen. So we have created a link to that qpp.cms.gov website directly from our provider setup screen. So if we go out here and we open one by one all of our clinicians, we have fake clinicians, so this won't really work well for us, but I'm going to show you where the link is. You can come out here and you'll see on this dashboard it says MIPS status, and there's this link. So if you click on this link, it will actually push that provider's in PI. It looks like we've got somebody's out there, and it will show you what's going on. So you'll notice this provider is eligible to participate in the MIPS. And what I want to point out to you down here is you have two options. So you can report as an individual or as a group. So if they're ineligible as an individual, they may be required to report if you're doing a group reporting. So make sure you scroll down and check that, okay? So let's go ahead and how do I turn on this new MIPS dashboard? So if you are already working with OfficeEMR, you've purchased the Mingle Analytics package, then we have already set this up for you. If you're just hearing Mingle Analytics for the first time, if you would like to go for the gold, if you're trying to earn a positive payment adjustment, it is very important that you get a Mingle Analytics account ASAP. When you do that, iSalus Healthcare will work with you to get quality measures selected for your practice, to get any template adjustments that maybe we need to make for you to be successful made, and to get you on your way. We are already I feel like you guys have lost my screen. Hopefully not. So there's my screen again. So that was weird. All right, so you will want to get with Mingle. If you need to get a Mingle account, you can go out to isalushealthcare.com. When you get there, you're going to go under the products and then down to additional services. Click on this MIPS reporting here. This page here will go over the different packages for MIPS. Most of our clients are choosing this middle option. This is the performance package. And if you have any additional questions about the Mingle Analytics packages, feel free to give iSalus support a call and we will walk you through this, okay? So let's go ahead. Again, if you worked with an iSalus implementer, we've already turned on the dashboard. If you're maybe just trying to do avoid a payment adjustment, you may not have purchased Mingle. It's not required for you to be successful. You will need to actually turn on the MIPS dashboard in roles. So you'll need to go to your setup portal, and then we're going to go to roles here, and we're going to give access to this new screen. So when you come to the role setup screen, we're going to just simply type in MIPS up here and we're going to hit enter. Now this first screen that comes up is not the one we're looking for. We're looking for MIPS Mingle data extraction, okay? And then you'll notice over here, these are all the different roles that you have in your database. This is a test database, so we've got a lot of them. You probably only have the ones at the top of the stars. And this is where you'll add grant access. So your administrators, you'll probably give write access. And then you may to your providers, give them read-only access. That will allow them to go in and see how they're doing, but it won't let them mess with the dashboards, okay? And once you adjust that role setup, you would just hit the save button and your users now have access to this new dashboard, okay? So let's go ahead, now that we've gone over how to turn on the MIPS dashboard, let's go ahead and go into the report. So we're going to go to the reports portal, and under the meaningful use section, you're going to click on MIPS Mingle, okay? This will load this lovely new dashboard over here to the right. So you'll see here that we are on the current reporting period of 2017, and we've already got one provider set up, but maybe we've got a multi-physician practice and we need to set up a new one. Let's walk through that. So to add a new provider, I'm going to click on this new piece of paper icon, and I'm going to come out here and search for that provider. And Isabella is who I wanted, not selector. There we go. Our reporting period, you're going to either pick 90 days or a full year. Now, one thing I want to touch upon, I think this is a big misunderstanding. I know I at least had this, and that is with the reporting period. So your reporting period, whether you do 90 days or a full year, it doesn't matter. What matters is how well you perform. So I think a lot of our clients, you've been on the CMS webinars, maybe other webinars, and you're under the assumption that you really needed to do a full year to earn maximum incentive points. That's not true. What matters for your reimbursement is how well you perform. So most of our clients are doing a 90-day reporting period, and they are starting October 1st of this year, okay? So you have to do 90 days. Okay, so I'm going to enter my provider, check my reporting period. What's the deal? And apparently my Zoom keeps going in and out. This is bizarre. So I'm going to share my screen again. I apologize for that. All right, and we're going to save this. You'll notice we're getting a warning. It's saying that it's not built any of the information. So this new MIPS dashboard works quite a bit different than our old meaningful use dashboard. The meaningful use dashboard, every time you would go in there and actually select a provider, we would at that moment in time go out and calculate all of the meaningful use objectives. For a lot of our clients, and even especially our larger clients, have a lot of data, it would take quite some time for them to actually load a provider. So we have changed it. So now each and every night, OfficeEMR automatically goes out and we're going to go grab the quality data for you and also your advancing care information data for you for all of your providers that you have set up. That way you're not having to waste all of that time to get that information calculated for you on the fly. However, we do have the ability for you to calculate that information on the fly, and I'll show that to you here in a moment. So ideally, when you come in here, you're going to set up all of your providers first. So if you could, you would merely come through here and set up all of your providers, and then after you've set up all of your providers, we're going to hit this hammer icon here. When I click the hammer icon, it's actually going to go build that data in the background. Again, a lot different than the old meaningful use dashboard. So you'll actually get an office communication in your inbox when that data has completed and finished building for you. Okay. So if you need to edit any of your providers, you can click on the provider and you can hit this edit button. That will allow you to change their reporting period. Maybe you want to change their start date. That allows you to edit that so that you don't have to fully remove them. You can also click the red X and that will remove that provider from your list of clinicians. Okay. So hopefully that covers setting up a provider. I'm going to check and see if we have any questions before I move on to the individual sections. And I don't see any yet. Okay, so let's move on. So over here on the right-hand side of this screen, this is our MIPS dashboard. And again, you'll notice MIPS is broken down into really right now 3 components, which is quality, improvement activities, and advancing care information. So advancing care information, in your notes, think of this as the old meaningful use, okay? This was that old meaningful use dashboard. Advancing care information is calculated quite a bit differently, and we'll go over that here in a moment. Quality, this is the old PQRS portion of Medicare, right? This was they've rolled a bunch of programs into one, so think of PQRS is now quality. improvement activities, this area is brand new to the program, so I don't expect any of you to have a lot of familiarity with it because it's a new piece of the program. Okay, so let's go over quality first, and our data should come back. So you can click on this refresh button here, and that will actually go look for that newly pulled information. So you'll notice that the last build now has today's date in 12/15, so it did finish running my data. This is where you're going to do data exports to provide to Mingle. So you'll only need this section if you're going for the gold, okay? If you're just doing the minimum as far as quality goes, you will still have to use Mingle Analytics. You will just need the Essentials package, and it is 100% straight attestation. So you really won't need this dashboard if you're just going to attest one quality measure for one patient one day. So in here, in our quality section, to export your data, you're going to come here to this little cloud icon, and you've got two options. So you can just export the current provider you're on's data, or probably the option you really want is all providers. This will export the data for all the clinicians that you have set up a dashboard for, okay? So when we click all providers, you'll notice we don't have a lot of information. Now it's going to bring up this screen. It's going to show you how many rows of data you have, and then you're just going to one by one export the data by clicking on the cloud icon. If you're exporting in Internet Explorer, this is going to go to your C drive and then your iCalis export folder. If you're working with OfficeEMR and Mingle Analytics, your implementer will probably be doing this for you, but I wanted to show this to you in case that you wanted to export this data and do your upload into the Mingle dashboard yourself, okay? So you would merely come out here, you would export all of your data, and then you can upload that into your Mingle Analytics dashboard, and they can give you a new performance report. So that is the quality piece. If you're going for the gold, you will need to report on 6 quality measures. And again, you'll need to go and obtain a Mingle Analytics account, and your Mingle, along with your iCalis Healthcare Implementation Manager, they'll work one-on-one with you to select those quality measures and make sure you're set up and good to go for tracking those, okay? So let's go ahead, and I'm not seeing any questions. So let's go over to the improvement activities. So based upon your practice setup, how many improvement activities you need to do will differ. So this is where going to the qpp.cms.gov website will be helpful for you. So here, this is just an overview of the improvement activities. So if your practice, if you have more than 15 or more providers, you will need to attest to up to 4 improvement activities. So improvement activities have a weight. They're either a medium weight or a high weighted improvement activity. So if you're a larger practice, you'll either need to do 2 high, you could do 4 medium, or you could do 1 high and 2 medium activities, okay? Most of you, I'm guessing, don't fit into the large group. You're a group with 15 or fewer participants. You might also be in a rural or health professional shortage area. If that identifies your practice, then you only need to complete up to 2 activities. So again, you could do 1 high weighted activity or 2 medium weighted activities for a minimum of 90 days. And then I know we have a lot of clients who are in certified patient-centered medical homes. They're comparable specialty practice or an APM. If you're one of those, you automatically earn full credit for your improvement activities. So you don't need to do any additional improvement activities on top of that, okay? So let's go back to our dashboard. We have automatically loaded all of the improvement activities here in this dashboard for you to go through. Again, a lot of our clients are already doing some of the improvement activities. For instance, if you're already using our telehealth services, that is a medium weighted improvement activity. If you are a part of our chronic care management, then you can also, that's another medium weighted activity. If you're providing 24/7 access to your eligible clinicians, you probably are. You've got a web-based solution and you're seeing patients after hours. That's another, that's a high weighted activity. So as you come through here, you can click on an activity that's going to open up and give you more details about that activity. It will tell you what the weighting is. It will also tell you a description of how it, what you're supposed to be doing, the validation of it, and then probably one of the more critical pieces is the suggested documentation. So in the event that you're audited, because this is a attestation piece of MIPS, this is a documentation you need to make sure you have on record for that improvement activity. So this piece is completely up to you as a practice. You'll just need to come through here, look through the activities. Again, you're probably doing a lot of these already. Pick ones that meet your current workflow. So when I'm working with clients, one thing I like to try and tell you or help direct you with is find things that you're already doing if possible, or are close to what you're already doing. You know, don't disrupt your workflow if you don't have to, right? So, you know, we're at the end of the year, the holidays are coming, you don't want to stress people out. So try and find activities that you're already doing, or maybe you're already doing some of them and just need to finish them out, okay? So that covers improvement activities. Again, you're more than likely you're looking for 1 high or 2 medium. If you're a large practice, you need 2 high, 4 medium, or 1 high and 2 mediums, okay? All right, and then the final piece of the MIPS pie, just so you know, quality, this is worth the biggest piece of your MIPS score. It's worth 60%. So you're supposed to report 6 quality measures. Each measure you can get up to 10 points, and you're wanting to perform well on those quality measures. So again, most of our clients, to perform well or perform their best, they need to do an end of the year reporting period. Another thing I want to talk about real quick while I'm thinking about it on quality is patients. So with PQRS in the past, there were different options for how you could do PQRS. Some of them you could do measure groups, you could do individual measures. It was all kinds of confusing. With the quality, you're reporting on all patients. Okay, so that's one thing I think that people get caught up with, or maybe they don't understand. They think they're only reporting Medicare patients. That is not true. You are reporting on all of your patients. So if you've picked a measure, any patient who meets the denominator of that measure, let's say it's for all you're doing 110, which I think is the flu shot. So any patient 18 or older who meets your denominator, they need to get a flu shot. It looks like I have a question. Yes, so that's quality. So I've got a question here, and I'm just going to answer it real fast. We got a question: if we signed up for chronic care management and iCalis will probably start it next week, can we use it for one of our improvement activities this year? I think so. So you've been actually engaged with us for, probably starting here this month. So definitely I would say you could use CCM as one of your improvement activities. And again, when you come in here, I think you'll probably be billing out CCM. So if we click on this, I would just make sure you go over this suggested documentation. I think a claim is one of your documentation, but you'll want to just come in here and make sure that you've got your suggested documentation to prove that you've been doing that improvement activity. Good question. All right, so let's go ahead. Sorry, I've got a drink of water, and let's go over advancing care information, aka the old meaningful use. So advancing care information is worth 25 points towards your MIPS score. So this is quite a large chunk next to quality. And this is something that is different. It's very different from meaningful use. So in meaningful use, our mindset was each objective you had a threshold you had to meet, right? And I think that's hard for a lot of our clinicians and our practice managers to get over because advancing care information, it's completely different. So with advancing care information, the only items that have a threshold are the objectives in your base score. And they're easy to meet, okay? So in order to get any points in advancing care information, you must first meet this base objectives here. So to do that, you have to have a numerator of at least 1 for all of these, okay? So you have to at least send 1 e-prescription. That should be a walk in the park for all of you, right? You have to perform your security risk analysis. So this is something that iSalus Healthcare doesn't do for you. It's something you do for yourself. And all of these objectives, just like on the meaningful use dashboard, you can click on, and it's going to give you a little bit more information on that. If you are a practice who has no idea what a security risk assessment is or how to do one, and you need help, we have a third-party resource that you can work with. They'll help walk you through performing a security risk assessment for your practice. And if you click on this link here, that will take you so you can learn more about that third party that you can work with. Once you've completed that, you'll simply come in here and you're going to click this attest yes, and that will give you your little check mark, okay? The next objective you have to meet is to perform health information exchange. So this is for one of your referrals to another provider or setting of care. You need to send their referral summary of care using direct, okay? So in order to meet this, your practice at first needs a direct email. If you don't have a direct email, we will send out information after this on how to obtain a direct email from our partner Secure Exchange Solutions. You can also come up here in the OfficeEMR search and search for direct email, and there will be an FAQ on how to obtain and set up your direct email in OfficeEMR. And in just a moment, I'll go through actually sending one of those so you can see that workflow. And then you have to provide at least 1 patient with access to their My Medical Locker or their electronic health record. So when you're checking out patients, on the Quick Pay screen, we automatically put a Welcome to My Medical Locker letter in there, and you'll need to be printing those out. That's how patients will count towards this objective. So once you get all of these objectives, these base objectives, you just need a numerator of 1, you can then earn additional information or percentage points towards your score, okay? So your base score is worth 50 points. All right, so I am seeing a question. Said we did our quality build and did not see any X's or check marks appear on our dashboard. So you may need to reload your dashboard. Anytime you click on a provider's name, it will reload the whole dashboard for you. You can also try clicking this little refresh icon here. If things aren't showing up, then your build either wasn't initiated by you, so you need to click the hammer icon. Or if you've clicked the hammer icon, then the build's not completed, so you may need to wait a few more minutes for that to come back. And again, you'll get an office communication when that comes back. I'll show you what that looks like here. So you'll see that build has completed when that comes in there, okay? Hope that answers your question. All right, so I hope you wrote in your notes for advancing care information. You must obtain your base score to get any points. It's worth 50%. And then the rest of your points will come from your performance and bonus points over here on the right, okay? So how you get points over here in these objectives is by performing well. So to try and not overcomplicate this, essentially what we're going to do is we're going to take your numerator divided by your denominator, and that's going to give you a percentage. How well did you perform for that objective? That percentage is then worth a certain number of points, okay? So for health information exchange for Isabella, she's 1 for 1. She's at 100%. and this is worth up to 20 percentage points. So right now she's doing well. But let's say she didn't do any health information exchanges. Well, she'd be at 0 because her bonus wouldn't be met, but she would be at 0 points. So the goal for you guys is to get your bonus, or your base, which would be 50%, and then you want to pick the objectives you know you can exceed and do exceptionally well out. Some of these are worth a lot of points. So the health information exchange is worth up to 20 points. Provide patient access, also worth up to 20 points. So those two right there can get you 40 of your 50 additional points that you need. And then you could maybe, if you're submitting to an immunization registry, that can get you those 10 percentage points and get you over the hurdle. So each person or each clinician, how they're going to get to their 100 points is going to be different. Okay, it's not like meaningful use where, again, you had certain thresholds. It's you're getting your base score, which is 50, and then your goal is to get 50 more points between your performance and your bonus score, however you can get there. So again, what you want to do is focus on the objectives with your clinicians you can do well at. If you can provide patient-specific education, and we'll walk through each of these here in a second, do that. If you can provide them access to their My Medical Locker when they check out, do that. If you're actively engaged with the Immunization Registry, do that. Okay, med reconciliation, another easy hitter probably for you. The ones that are probably going to be harder for you would be secure messaging, because your patients have to either send you a message or you have to know they're connected and send them a message. And also this view, download, transmit, that's requiring the patient to actually look at their clinical summaries in My Medical Locker. So those two are going to be hard to get, or harder. Health information exchange for some might be a challenge if you don't have a lot of providers that you refer out to that have a direct email. So, patient-specific education, provide patient access, and med reconciliation. These three right here are easy hitters, are ones that you can control with your staff and your actions. So those are ones I would highly recommend that you go after. Also, again, the immunization registry. If you're capturing immunizations, we should be sending those out to a registry. Those are easy hitters. In your bonus over here, syndromic surveillance, if you are sending syndromic surveillance data to a registry, you can get an additional 5 percentage points from that. Or if you're sending data to a specialized registry, those are worth 5%. And it's either of these. You can't get double. This final one is improvement activity using a certified EHR. So if you come in here, we've got a link to an improvement activity guide. And if you go to the bottom, there is an appendix B, the very bottom of this puppy here. This will actually tell you which improvement activities that you can do. And I think chronic care management is one of them. Let's see here. But this episodic care. But this will go through, chronic care and preventive management. This will go through which of the improvement activities they consider you doing with a certified EHR, and that will get you 10% percentage bonus points. So that could be something that helps kind of move your score. And a lot of these are, again, they're attestation. So you're in chronic care management, we'll attest yes there, and we're going to get 10% there. Same with your immunization registry. If you're doing that, it's an attestation. We're not going to figure that out for you. Okay? All right. So any questions so far about that before we go into each one of these? And I'm going to show you how to actually meet all of the objectives. Any questions? Thank you. I'm seeing under the performance tab, how many measures do you need to meet? So it's not necessarily meeting measures, you're looking to get points, okay? So first you have to get your base score. If you don't get a check mark in each of these objectives under the base section, then you can't get any points, period. So you need to get a check mark at each of these objectives here. That's going to get you 50 or half of your points. Then again, you need to pick the objectives that you're going to do best at, and you're trying to get an additional 50 percentage points from either your performance and your bonus sections, okay? And how you get points is by excelling, is by performing well. So you want the best percentage of your numerator divided by your denominator to maximize the number of points you get for each objective, okay? So I hope that helps. And again, things that you can most easily control as a practice are going to be patient-specific education, provide patient access, the Immunization Registry, and med reconciliation. And Alexandra, you guys are going to be a part of chronic care management, so you should also qualify for this improvement activity, which is 10 percentage points. So that will get you 10 percentage points there. So again, everybody's score is going to be differently. Your percentage points are going to be different from objective to projective. You're just trying to get 100% down here. That's your goal. I hope that helps answer that question. It's quite different than meaningful use. And I know it's not necessarily a black and white answer, but I hope I was able to express that in a meaningful and helpful way for you guys. So let's go ahead. If you have more questions, go ahead and send them my way. I'm going to jump into how do you meet each of these pieces, each of the objectives. So e-prescribing, I don't know that I need to show you that, but you're going to send an electronic prescription. So in your prescriptions chart tab, I'll do this just to make sure nobody has any questions. You're going to make sure you send at least one prescription electronically. And again, I think most of you, you're at like 99%. So this is not even a question. You're there. So when you're prescribing medications, chunk, let's have a mighty favorites list here. You just want to make sure that you select a pharmacy and you're going to hit the send button instead of print. So if you do that during your reporting period, then you're good on that objective. All right, so that's e-prescribing. Security risk analysis, again, that's something you need to do externally. If you need help with this, again, if you click on that objective, we've got a link, and that will take you to more information about a third party that you can work with that will help you get that done. That's an attestation. And there is documentation that you'll need to keep on file for that, so make sure you've got that if you've already done your analysis. Health information exchange. So let's walk through this one. All right, so in the EMR, the first thing you need to do is you need to have an order. So you have to have a referral order. So we're going to go to our order entry chart tab. So for a patient to even be eligible for this objective, one, they need to have been seen during their reporting period, and two, they need to have a referral order selected for them. That's who's going to be in your denominator for this objective, okay? So we'll select template here. Maybe she needs a cardiology referral, and I hit save. And I'm also going to need to make sure I have Jill a super bill that she was seen, or she won't show up in my denominator. So we'll go here. All right, we'll just say, sure, that's what she was seen for. Why not? Selecting stuff, save. Okay. So once you have selected, she's been seen, she's got her referral order, the next thing you need to do is obtain a direct email for that provider of care that you referred that patient to. So office managers, I would recommend that if you have providers that you commonly refer out to, I would make a note that one of your tasks is to start contacting all of their offices and figuring out who's got a direct email so that you know who to send them to. If we have an outside billing company, how will I have the super bill for proof? Was a question. So if you're not tracking the super bills with a zero, what we would want to do if you're not billing out of iSalus is we would want to set up your super bill so you're still tracking your charges, but they'll just have a $0 amount. And that way we have those visits. All of this information goes off of billing data. So it's very important that we have that billing data in OfficeEMR, or none of the reporting will work. So Wendy, I can work with you offline if we need to kind of talk about that more. All right, so let's go into communication. So the next step would be we're going to send our direct email to that provider of care for that patient, and I was using Jill Kaser. So in office communication, you do have to be set up with a direct email. I'm not going to go over this now. If you need help, let us know, but my user is set up with a direct email. So under the new button here, you'll notice I have this drop-down icon. So when you're set up with direct email, you get this new option. I'm going to click direct message. So my mouse seems to be having issues today or something. There we go. All right, so in the two, this is where I'm going to search for their direct email. I think I have like a Isalis here. Okay. We manage all the direct emails in setup contacts. Also, if you have providers set up, you can add their direct email on the provider setup screen and search for them that way, FYI. So referral summary of care is what I'm going to put the subject as. And then this is the key piece. I need to attach that referral summary of care, that transition of care. So I'm going to click on the attach button. And the first thing I'm going to do is search for my patient. The other cool thing about Direct is you can send documents, which is pretty sweet. So if you need to send a document to another provider, you can do it using Direct. It's pretty cool. So we're going to look for Jill Kaser here. Okay. Now for this email, we're going to send this transition of care. So it was requested today, and we're sending her maybe for an EKG. Referral for EKG. Okay. So then I'm going to hit attach. And I'm going to close. And then I merely hit send. And this is going to send this transition of care, which I should be able to open up here. Oh, yeah. It's not opening for me. Let me send it and we'll open it that way. But it's going to send that nice summary of care electronically to that patient, to that provider. And the cool thing is when you get them electronically, you can then put them in the patient's chart, and they then show up in your med reconciliation to do med reconciliation from. So it's pretty sweet. Okay. And that's all you need to do. So you'll need to do that for at least one patient. And again, if we go back to our dashboard, that's going to get your health information exchange to be checked for you. And again, you can get up to 20 percentage points here. So if you've got providers of care that you refer out to that have direct emails, send them those referral summaries of care, because you can get some easy points for your advancing care information off of this objective here. CMS really wants us to be taking place, okay? Any questions so far about those objectives before we go on? Not seeing any in our queue. I'll move on. So health information exchange, you'll notice it's in two places. It's the same thing, okay? You just have to get one for your base score, and then any additional exchanges that you have there, they'll give you additional performance points. The same thing with provide patient access. We didn't go over that yet, so let's go into the scheduler. So when your staff is checking out your patients here, we've seen Jill, we're going to check her out. When you hit checkout, we're automatically going to go see if she's got an MML account connected. And in the event that she doesn't, we're going to automatically put a welcome to my medical locker letter in her print queue. So you'll notice she's got like a bunch of stuff out there. Let's sort this here. So we automatically put that clinical summary and the welcome letter out there. So, I mean, I could be select all this other stuff. Ideally, you don't have all of this for your patients, right? Because you've been staying on top of their print queue. Oh, I should have showed patient education too. That would have been cool. All right, so I'm going to leave that where it's at, but essentially you just need to come in here and hit the print button. Let me go show you patient education while we're on the print queue. So let's go into the EMR. So patient education. So we have a specific tab called patient education. And we can actually hook up into the National Library of Medicine, into their database of patient education. So what we'll do, we've got that turned on in our database, is it's going to look at the patient's order results that they have, their current problems, their current medications that they're on, and it's going to give you those as suggested patient education materials. If your practice also has their own education materials, we can load those in here for you to select from. You know, asthma, anything that you can come out here and select from, but you essentially just come through here. These are the ones that are suggested per this patient's clinical information. So maybe we want to send her some information about fasting glucose and amoxicillin capsules. So the doctor just clicks on what he wants to educate that patient on, and we're going to hit save. Cool thing with this tab is if your patients already have a My Medical Locker account connected, we're automatically sending that stuff, those education materials, to their MML account. So you don't have to print them. It goes automatically electronically for you. But in the event, I don't know that Jill has an account set up. Let's see here. I wanted, not that. Patient, My Medical Locker admin. She is not connected, so that would go to her print queue. So when we go back to the iScheduler, when we go back into the quick pay screen, those education materials are going to be in her print queue as well. Okay. So you would just need to print all of those out. There we go. All right. So there are those materials there. Okay. So big piece is make sure your front office staff, they're checking their print queue and printing those materials out for your patients, because that's going to be getting you easy points, again, towards the provide patient access, as well as the patient-specific education. If you need any more help about getting patient-specific education set up for your practice, go ahead and let your implementation manager for MIPS know. You can also contact our support team, and they can walk you through that. Okay. Immunization Registry. So this is an attestation, but that is to our reports. You've got the immunization export in here. And this is, if you're actively in here and you're exporting your immunization files and you're uploading those to a registry, then that will get you, that's how you will get that. You obviously have to attest that you're doing that. We're not going to attest for you, but that's where you will get those reports from. While we're there, syndromic surveillance, that's this export here covers that piece. Let's go over med reconciliation. So in the EMR, off of our timeline summary screen, we go to the summary. You click on the clipboard icon here in this lower left-hand corner of the summary screen. This is where you can do patient education. And I wonder if I have any, there we go. All right, so this is going to show you all of the information we have. Now, this patient doesn't have any external data we're comparing against. If you'd received a summary of care from another provider and attached it to the patient's chart, that information would show in here, so that if maybe there were some allergens or some meds that maybe you didn't know about, you would be able to import those into their med list or their allergies list from that document. Very slick. But essentially, this allows you to come through here, look at their current record, look at maybe external sources and what you might be able to bring in from that. Maybe they no longer think they're allergic to sulfa. You can inactivate things. Maybe they're not on Zoloft anymore. You can stop it. And then you're going to hit the save button. You have the option of hitting preview. What that's going to do is it's going to show you what the patient's chart will look like when you hit save. It's kind of a preview of what things will do. And then once you're okay with that, you hit save. And doing that will count towards med reconciliation. Now, one thing that I know have seen clients get hung up on is their providers are doing med reconciliation, but nobody's showing up in the report. Well, that's because, are you seeing new patients? So your patients have to be in the denominator to even be eligible for this objective. So if you're not seeing any new patients, then that may not be an objective. That's a good one for your clinicians to meet. Okay, so FYI, this particular objective is looking at new patients. Okay, new patient visits, and those are your patients who will be in your denominator for that objective. So while your staff may be doing med reconciliation, if they're not doing new patient visits, it doesn't count for them. Okay. Secure messaging. So this is you could do this multiple ways. So one way is if you get a secure message from a patient you're connected to from their portal, you reply to it. And then the other thing is if you initiate a message. So let's do the first. Let's see if we have any out here. I'm not sure that they'll be tied to Patrick Hines. Let's see here. So this is not for our providers, from a different one, but we'll just pretend it was. So if we respond back to the patient, this would count towards secure messaging because we received a message from the patient and we're replying back to them. So we could say, please call our staff for a referral to a personal trainer or something like that. I don't know. We're going to hit the check mark button, and that's going to send that back to the patient. You are able to initiate messages, so still is not set up. In the event that the patient was set up, when we go up here to communication, in the two, there would be an option that would say patient/rep. You would pick that, and then when you could send a communication directly to that patient's My Medical Locker account, and that would count towards a secure message. So hopefully that answers that question. I did have a question about patient education. Do you have to print it out? So you don't have to technically send it to the printer, but you have to go through the process of printing it. So when we go into our quick pay screen and I go to print queue, I need to hit this print button for it to count that I gave that to the patient. But in the event that maybe you've got the pamphlets already printed out and you're handing them to the patient, that's okay. That'll count. You just need to go through this act, and then I'm not going to wait for the PDF to render, but instead of sending that to the printer, I'm just going to X out of it. But that would count that you had provided that to the patient. So if you are providing patient handouts, still go through that print process. Just don't send it to the printer and waste the printer paper. So that was a good question, Alexandra. All right, let's go back to our reports. What else do we have? We've done that, we've done that. View, download, transmit. So that is, you get to that actually in My Medical Locker. I'll just take you in there so you can actually see what this looks like. Let me see if I remember my password. Try again. Let's see here. Anybody else have trouble remembering? All their passwords. Let's see here. Try that one. There we go. Third time's a charm. All right, so when the patient is in here and they click on one of these summaries, then that counts as the view, download, transmit. So that is how you can, your patients can meet that objective for you. Again, that's something they have to do, so you can't control it. However, we do have the new mobile apps. Maybe I'm not approaching this right. We have the new mobile apps. So one thing you could do is when your patients are maybe waiting to be seen, have your front office staff help them get set up and register in the mobile app, and then have them go and download that, and that will count. But that's up to you. It may be easier to maybe control some of these other objectives. Syndromic surveillance, we kind of went over that. That's doing this syndromic surveillance export over here and submitting that to a registry, a specialized registry. That would be something you're doing on your own. And then improvement activity, we went through this, looking at that appendix and seeing if any of the improvement activities you selected count for as using certified EHR technology to do them. All right, so that is advancing care information in a nutshell. What questions do we have? We are 2 minutes from being on here for an hour. I'm not seeing any additional questions. So I would like to thank you all for attending. We have recorded this on YouTube. We've actually been live on YouTube right now. So I will send all of you a link to that recorded video so that if you want to go back, you absolutely can. Again, if you are trying to go for the gold, make sure you get hooked up with Mingle as soon as possible. Yeah. Let me see here. I see a raised hand. Let me see how to. When do we know to send the report to Mingle? So good question. So for your quality pieces with Mingle, what I would recommend is probably, if you haven't already done so this month, here at the end of the month, I would get your first quality report submitted to Mingle. And again, work with your implementation manager. They'll help you upload those for you. I know I've been doing it for all of my clients. So more than likely, they'll help you upload that or at least walk you through extracting that data and doing an upload into the Mingle site. I would then recommend doing another one at the end of November and then probably one in mid-December, just to make sure you're on path, that you're doing everything you need to do before the end of the year. And then in the new year, that's when you would do your final data extract and upload into Mingle to submit to CMS. So hopefully that helps, Alexandra. I would definitely probably get a clinical data extract to them within the next week or so, for sure, to make sure that you guys are doing as well as you hoped. Any other questions before we end? Well, thank you again, everybody, for attending. Let's see here. I'm getting a raised hand. Alexandra, if you'd like to talk, I don't know if you still have any additional questions. You should be unmuted. All right. Well, thank you, everybody. If you have additional questions, feel free to reach out to me via email. You should have it from the Zoom meeting. And have a great rest of your Tuesday. Thank you. Take care.